This method can be accomplished by 1 or 2 caregivers. Shove the Patran under the patient, then pull it out on the other side. Pulling out the Patran is important for boosting, but may not be for transfer. Don't worry if you poke holes in the Patran, it will still work. First, tuck the Patran under the patient up to or just beyond his spine. Patients can be transferred with a draw sheet, pad, or towel, but longer linen gives them more support. For more information, see the push-pull transfer video. In this case, a bariatric Patran is being used and the patient has no mobility. One caregiver shoves the Patran under the patient while the other caregiver pulls it out the other side. Using the draw sheet, they boost the patient. Accelerate slowly when boosting to prevent the draw sheet from moving under the patient and shearing his skin. This video was submitted by Kurt DeWeese, physical therapist with Work Injury Solutions in New York. He and others recommend a segmented approach to patient transfer. After placing the Patran sheet or sheets, the caregivers next to the originating surface start moving the patient's upper body as the primary movers. They then transfer the patient's lower body. As the patient crosses between the surfaces, the receiving caregivers then become primary movers, rocking back to use their body weight to move the patient. Tuck one Patran from each side until they overlap in the middle under the draw sheet or pad. Use the draw sheet or pad to boost the patient. Remove the Patrans. The caregiver pulls the Patran out from under the patient's feet, turns the far corner under itself, which lets the Patran slide on itself, and pulls it out level from under the patient, walking at an angle toward the patient's head and pulling the Patran hand over hand like a rope can make removal easier.